Hello, today we will be dealing with Module 2 Patterns of Maladaptive Behaviors from the paper Psychopathology. So, first of all, let's see stress and adjustment disorders. So, disorders that comes under this category are reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and adjustment disorders. And for any of these disorders to be diagnosed, the person or the patient must be exposed to a traumatic or stressful event. So that is the basic criteria to diagnose any of the disorders that comes under this category. Many individuals who have been exposed to a traumatic or stressful event exhibit a phenotype in which the most prominent clinical characteristics are anhedonic and dysphoric symptoms, externalizing angry and aggressive symptoms, or dissociative symptoms. So here we all know that if a person is exposed to a stressful event, definitely he or she must be having anxiety or fear-based symptoms, right? But according to this particular category, the most prominent clinical characteristics are anhedonic and dysphoric symptoms. Anhedonic means the inability to experience pleasure in pleasurable activities. Dysphoric symptoms means that uneasiness or generalized dissatisfaction with life. Externalizing angry and aggressive symptoms, that means the person will not be exhibiting his actual emotions, will not be expressing the actual emotions. Or dissociative symptoms, that is dissociative symptoms, we will discuss in detail about it later, but it means a sense of detachment from one's own emotions or from oneself. And because of these variable expressions of clinical distress following exposure to a catastrophic event, all these disorders are grouped under a separate category called trauma and stressor related disorders. So let's see what is the first disorder, that is reactive attachment disorder. The diagnostic criteria for diagnosing reactive attachment disorder are the following. Criteria A consistent pattern of inhibited, emotionally withdrawn behavior towards adult caregivers manifested by both of the following. So, the first criteria says that the child or the patient will be inhibited or emotionally withdrawn uh, from the adult caregivers. So the two symptoms are the child rarely or minimally seeks comfort when distressed. The child rarely or minimally responds to comfort when distressed. That is, the child is completely emotionally withdrawn from the adult caregivers. And the second or B criterion is a persistent social and emotional disturbance characterized by at least two of the following. So I'll be saying three symptoms, and any of the two symptoms must be met to diagnose this disorder. That is minimal social and emotional responsiveness to others, limited positive affect, episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions with adult caregivers. So, as I said earlier, the child or the patient must be having very minimal or rare social or emotional responsiveness to others. Limited positive affect means the patient must not be showing any kind of positive emotions to the caregivers, and episodes of unexplained irritability and sadness. There might not be any threatening situation, but still the child must be having irritability or must be showing sadness, fearfulness, and all, but there must not be any underlying cause for it. The child has experienced, that's the criterion C, the child has experienced a pattern of extremes of insufficient care as evidenced by at least one of the following. So, the thing is that the child must have experienced insufficient care from the side of the caregivers, and at least one of the following criteria must be met. Social neglect or deprivation in the form of persistent lacking of having emotional needs of comfort, stimulation, and affection met by caregiving adults. Repeated changes of primary caregivers that limit opportunities to form stable relationship. If the caregivers keep on changing, then the child won't be able to build a proper stable attachment with the caregiver. So that would also be another reason. Rearing in unusual settings that severely limit opportunities to form selective attachment. So it was shown that these children who has this disorder have this capacity to form attachment with selected caregivers, selected people. But here, since the child is reared in an unusual setting, they will be having very limited opportunities to form a selective attachment also. So the criteria, any of these symptoms must be met. Then the criteria D is the care in criteria C is presumed to be responsible for the disturbed behavior in criteria A. So let's go back and see what is criteria A. So the criteria A was the emotionally withdrawn behavior shown by the child. So here the criteria D says that the care in criteria C is presumed to be responsible for the disturbed behavior in criteria A. Criteria A. So the insufficient care from the part of the caregivers is a result of this socially and emotionally withdrawn behavior by the child. So criteria A is that the criteria are not met for autism spectrum disorder. So any of these centers must not meet the criteria for autism spectrum disorder. The disturbance is evident before 5 years, that is the criteria F. So it should be evident before age 5 years, and the child has a developmental age of at least 9 months. And the therapist or psychologist must also specify if the disorder is or the symptoms are persistent. The disorder has been present for more than 12 months, and also must specify the current severity. Reactive attachment disorder is specified as severe when the child exhibits all symptoms of the disorder, with each symptom manifesting at relatively higher levels. So each symptom that we have discussed earlier must be shown at the higher levels, and the disorder is on the severe side. Now let's see what is the prevalence rate of this disorder. So this is not a very common disorder. The prevalence of reactive attachment disorder is unknown, but the disorder is relatively seen rarely in clinical settings. So as I said, it's a very uncommon disorder. It's rarely seen in clinical settings. The disorders has been found in young children exposed to severe neglect before being placed in foster care or raised in institutions. So you can see that the main cause of developing this disorder is the neglect from the caregiver. However, even in populations of severely neglected children, the disorder is uncommon, occurring in less than 10% of such children. Okay. So now let's see what are the risk and prognostic factors of this disorder. So the risk factor include environmental, that is serious social neglect is a diagnostic requirement for reactive attachment disorder, and is also the only known risk factor for the disorder, which we have already discussed. However, majority of severely neglected children do not develop this disorder. Prognosis appears to depend on the quality of caregiving environment following serious neglect.